that already in our income level, by the way. The second thing is that it doesn't tie coverage to your employment status or your circumstances. So everyone is covered, whether you have employment, with an employer, or you're a small business owner, or you're not employed. Everyone is covered. And again, we're the only country at our income level that doesn't do this. And then the third thing is how you pay for it, and we'll talk a lot more about that. But how we pay for our healthcare now is you're paying for premiums, you're paying for deductibles and co-payments, and a lot of those payments happen at the time when you need care. And then you worry, am I going to go bankrupt if I actually go to the ER? Am I going to get a surprise bill? So all of those things, the way we pay for it, you pay in advance through a fair tax, rather than all of these other ways, which I consider actually also a tax, but a tax on the sick. Deductibles, co-payments, they're a tax on the sick. So what does this mean for the New York Health Act and how to fund it? It's meant to be paid largely by a fair, progressive tax, income wealth tax, part of it through the payroll, and however you're paying taxes now. But it's more on your ability to pay, rather than now on how much of healthcare you need and how sick you are. And all of the other existing programs would be funneled through that pot. So Medicare funds, Medicaid funds, everything would go through that pot. And so as we collect this money in a fair way, we have pretty much the same amount of money. All of the analysis that I've seen would not raise the total amount of money that we spend. It would keep it the same, and over time even go down. The difference is where this money is coming from and how it gets dispersed. So it's coming through this one pipe, which makes it much more efficient.
Right.
We take away the 18% that we're currently funneling off to the private insurance layer. That doesn't bring us any value. No. So their profits, their marketing, their administrative, and that doesn't even count the administrative costs to providers themselves of having all these different payers. So we have this pretty much the same amount of money coming into the system, but it's coming in a more fair way, and we can use it more efficiently.
Right, and that's the big thing is people get scared off by, when you say taxes, right? People always, the minute you mention that word, everybody, runs for the hills. But, when you look at how much you are spending yearly on health, not just the premiums, which everybody, you know that up front. Like me, I think I spend about $800 a month on my insurance, which is actually pretty good compared to some people I know. That's a lot of money. But you also have your copays if you get sick. That's potentially, if you have to go to an urgent care, for me, that's $50. If you have a deductible and you had any serious tests run, that's going to be another set of money that you have to get up to. I think for my family, it's $5,000. And then you have throughout the year, I wear eyeglasses. You wear eyeglasses. They covers a certain amount, usually the insurance, but then there's always, I still walk away usually spending $250 on my lenses, because it covers the basic lenses. But then if God forbid you don't want them scratched, you got to pay for all that. So there's and then there's the dental care, which the New York Health Act does include. I just went through it. I just had 2 teeth removed, and I was handing my card over a million different times, and there is just so much involved in healthcare that people don't consider a tax. And like you said, it's a tax on the sick. I had a big tax this month, and my kid had his adenoids last year. We're still getting bills from that. So it's, yes, it's scary when you say the T word, the taxes, but let's look at how much you end up spending yearly. And maybe there's some years where you don't hit the doctor a lot. If you're lucky, if you're a family of 4 like me, you're hitting it no matter what. There's no way to avoid it. You're going to the doctor a lot. But if you're a single person, you're going to look at it and go, well, why do I have to pay, maybe a little bit higher in taxes because, of all these people. But in the end, you may be that person someday that is going to need all those different services, and it'll be there for you, just like it is just like it would be for me and my family of 4 now. So the taxes scare people, but it is building off of infrastructure that's already there. The Medicaid money is going to go into it. The Medicare money is going to go into it. And everybody is going to, be able to, understand their bills too. You generally won't have them, but right now a bill, the fact that you get 9 bills from a hospital visit, in a year is crazy. You just don't know. You're going to get one from the anesthesiologist. You're going to get one from the doctor. You're going to get one from the doctor's helper that you didn't even know he was in the room. It's completely crazy to me. And we just need to get people past, the T word.
Exactly. So I'm not quite sure why that's been so difficult, because it's the cost that comes out of your family's pocket every year that should matter, whether it's a T word or a B word, the bill word,
Right.
which if you talk to my friends in Europe, Australia, Canada, they don't know what that means, a hospital bill. You don't get a bill under
Right.
these systems. A bill never comes to you. So why are we more afraid of the B word than the T word? But if we look at actually what people would be paying, who would be paying more or less under this bill, that's what people want to know. Would I pay more? And so there's a lot of analysis actually, and quite good analysis of the financing of the New York Health Act. The study that gets the most attention is done by the Rand Corporation, a think tank in California, completely independent. And they found that basically 90% of New Yorkers would pay less under the New York Health Act than their total cost now with premiums, deductibles, co-payments. They would pay less. So it's not until over $250,000 a year income, like total family income, would you start to pay more. And even then, it's not that much more until you hit over $1 million a year. So this is a really well-structured bill. 90% of New Yorkers, I think all of us here, would pay less.
Right. And the other thing people hit at me with is, well, 96% of New Yorkers have health insurance. Well, first of all, 4% of New Yorkers is still a lot of people. That's number one. Number two, just because you have health insurance doesn't mean it's quality health insurance. It doesn't mean it covers anything. The very basic plans on the marketplace are garbage, and they don't cover anything, and they have incredibly high deductibles before you ever are able to get anything reimbursed. So just because that number of 96% sounds like a lot, and it was the same way with the coronavirus, right? People were like, it's got a 98%, recovery rate. It's like, well, what about that 2%? That's a lot of people, and we got to remember that when it comes to the New York Health Act, 100% is better than 96%. And, 4% is still a lot of people. And also it's an improvement in coverage. A lot of those 96% of people don't have dental insurance. And that, let me tell you something, that dental insurance, as it is, doesn't cover a whole lot. If you have dental insurance, I pay not a lot of money for it right now, but it also doesn't cover a lot. It's covering a very tiny percentage of what a lot of these procedures are. And with the New York Health Act, it's going to be covered. Eyeglasses are going to be covered. These are not things that people have under basic health insurance.
Well, I think you're hitting on something that really motivated me to get involved in this. I've always been concerned about people without insurance or people who could lose their insurance, and I think we'll talk about that. But it's the underinsurance, that people who think they have good coverage. You think you have good coverage until you need to go and use it.
Right.
And watching over the years that the Affordable Care Act has been enacted, I've been watching very closely the research. The behavior of the private insurance companies has been to innovate on better ways to shift costs, deny care, reduce access to providers. Out here on Long Island, a lot of the insurance carriers don't even include Southampton Hospital in their network. So the ways that they are actually reducing costs, you might think you have good coverage, but when you go to try to use it, the provider, you find out later, wasn't in your network, or you get a claim that was denied. And all of these ways of making you not actually have coverage are hidden. And they're making people have false security that they're covered well. And that's something I think that underinsurance is really a larger problem now, especially in New York, than the uninsured.
Right. And I mean, the other thing too is, you saw this a lot during the Democratic debates, was everybody saying how much they love their insurance. It's like, first of all, you tolerate your insurance. You don't love them. You're not going to invite them over for Thanksgiving dinner. The idea that people won't be able to live without United Healthcare in their lives is completely insane to me. And it also doesn't mean they won't be involved. It's just baffling to me that those talking points got through to some people. It's like, no, I mean, I don't love dealing with my insurance, and I'm always questioning them. Every time I get some rejection, it's like you got to argue with them. So I think we hit on the how we're going to pay for it pretty well. Is there anything you want to add to that?
No, I mean, I think for me, it's also like this idea that, and I think Gustavo Rivera puts it really well, that we have a swimming pool that is how much we need to spend on health to get the good services that we need. And if everybody brings one bucket of water and pours it in, eventually you fill the pool, and then people can take it out as they need it. And that's what we're talking about here, spreading the costs over more people, a more predictable and fair way. And then when you need it, you take what you need out of the pool.
Right, and it's one of the things that the Affordable Care Act had originally, was that's why the mandate existed, that people said was unconstitutional because it doesn't work. Trying to defray the costs, the healthy people need to be involved too, because the sick people are going to take the money. But one day you're going to be the unhealthy person that's going to get the money too. So it ends up working out for everybody. So the other thing we wanted to touch on was provider issues during a crisis. And obviously we are in a major health crisis right now with COVID-19. Healthcare systems are in trouble. We look at all the issues that hospitals are going to have in terms of funding at the end here. And one of, when we had our pre-call, me and you talked about how this would improve our ability to respond to these issues, and hospitals wouldn't get possibly bankrupt like they are going to be now.
Yeah, so the COVID-19 pandemic crisis is really exposing a lot of the flaws in our health system and making them even more acute. One of them is tying health coverage to employment. And so now that we have 30 million people becoming unemployed in the past few weeks, they lose their health coverage. So that's one perverse part of our system. But the other perverse part of our system that I don't think we've actually had to grapple with until this current crisis is that our doctors and hospitals only get paid if they're doing certain services, if they're providing certain services, providing lucrative services, and a lot of those are elective. And so now as the hospitals prepare surge capacity or to prepare to have to see a lot of COVID-19 patients, they've canceled their elective services and they're not getting any revenue. And our outpatient providers, nobody's going to the doctor, so they're not getting any revenue. And we're seeing very dire predictions. I'm following this every day about hospital furloughs, closures, our ambulatory care sector. We don't know if they're going to survive. Our private, practice doctors, they got a little bit of help from the government in some of these bills that are coming through Congress, but not enough in a lot of cases.
Right, drop in the bucket, yeah.
But yeah, it's a drop in the bucket. And so when I speak to my colleagues from countries with single payer systems, they are surprised. They have the pot of money. They've collected this pot of money. They have it, and they can keep their providers alive during this time, either by paying higher rates for the services that they are providing or just continuing to pay them, in this time. They have the resources. They can deploy them as needed. And they have the whole system view. They can look at, okay, here's our pot of money. Here's where we need it. And they can deploy it where it's needed. We don't have any of that strategic potential in our private for-profit system. And I'm very worried about what our health service delivery system is going to look like on the other side of COVID-19. Forget about even just responding to the crisis today.
Yeah, and it's in all likelihood we have no idea because we're so focused on this particular issue that we're gonna, hopefully someday soon take a breath and start evaluating where we are, and we might be in deep trouble, where we're not necessarily focused on that right now, and it's not the major issue. It will be later, because we all rely on these hospitals to take care of us when we're sick, injured, when we're giving birth. These are serious issues.
Yeah. And if we had a health system that was, as envisioned in the New York Health Act, a single payer. The payer is the single part. The providers are the same. They're the same private network that we have. They would be able to use that as a strategic public asset right now and be able to protect our service delivery system as we get through this crisis.
For sure. And the other thing too, and you kind of touched on a little bit, hospitals and healthcare services, they employ a ton of people in our society. So one of the fears too is how is it going to change what the side of employment looks like in that world, because there's a lot of people that do the billing, there's janitors, there's orderlies, there's nurses, there's doctors, there are the facilities people, the people that keep that building running, those hospitals running, the people, the electricians, the plumbers, that all throughout that building that are crucial to keeping them operating. A lot of people get concerned that we're going to start undercutting them and we're going to start cutting jobs there. And while that's not true, how do we stem the fear that they have that's going to happen?
I'm really glad you raised this. How do we pay for these services under a single payer system? And when this agency effectively is setting the prices, and there are a lot of fears that then this agency would be squeezing what they pay hospitals and doctors in order to stay within their budget. And so, yes, there are opportunities to be more efficient. If you are the single payer, you have that purchasing power, you can negotiate with hospitals and doctors. That is a source of how we can manage this sustainably. But remember, we're losing 18% of our funds right now that go to
Right.
nothing, that go to private insurance, that are not going to our hospitals and doctors.
Right.
So we get that money back. So effectively, we have more to work with in how we pay. Second, no one wants to put too much pressure on our provider side. That we need them to deliver good quality. We need to bring the best and the brightest. So the kinds of pricing approaches that would be taken would have all of these objectives in mind. And
Right.
looking at what we have in Medicare payment, Medicaid payment, private insurance right now pays average prices that are double that. And so there's got to be some, I think, middle ground where we can still pay above what current public payment rates are, but be a little bit more reasonable. And I think the bigger opportunity here isn't so much how much we pay, but how we pay. And there are a lot of opportunities in how you pay hospitals and doctors to create the right incentives in the system, to deliver more of the services that bring high value, more primary care, more prevention, chronic disease management. And that might mean paying a little bit less than we do now for things that bring less value, some of the imaging, some of the things that don't save lives, that, you know, when they're actually really necessary, they get paid well. But we would be able to be a little bit more strategic about the incentives and where the services are more lucrative.
Right. And, you know, two, these provisions for retraining. I mean, yeah, to make sure that the people that maybe handle the billing that have to move on to something else, that we actually retrain them properly, and in jobs that stay in maybe in the healthcare field. The important thing there too is, I think, and it's something I will fight for when I get to Albany, is making sure that those provisions have teeth. Because I think, you know, we've done that before, right? Where we have said, oh, well, retrain these people, and then we don't actually provide them with any ability to retrain. Because it's not just about retraining. It's like during that period of transition, you know, they still have families, and they still have to take care of their families. So we need to also make sure that they have the ability to live during that period of retraining. And I think that's an important factor too.
Yeah, I think you're right. You're talking about, I think, on the private health insurance side, that's a big industry.
Yeah.
And under the New York Health Act, private insurance wouldn't go away totally. That's a bit of a myth. There's still a role for some supplemental insurance for things that are outside of the coverage of this plan, although there wouldn't be much. This is pretty comprehensive. But it would certainly be much, much smaller.
Right.
And you do have to find ways to how to absorb those people back into the workforce in other ways. And the New York Health Act does include some provisions for retraining and thinking about how to redeploy that workforce. I think you're right. It would require a really serious look. I think there are opportunities to bring people back into more high valued jobs, rather than working in all the billing and claims denial departments of the insurers. That a lot of these people do have clinical training. There might be other roles. You know, this new agency will have new opportunities as well. I think it's a very serious issue. There are provisions for this in the Act, but I think it would have to be, as you said, looked at in a way that is very serious and meaningful.
Right. Yeah.
So I was going
And
to say, on the hospital side, you know, we would imagine that demand for services will go up. If more people have better coverage, the demand for our health services will go up, and that should create some jobs on the health provider side. But they won't need to be spending their resources on huge billing departments and all these people that have to spend their days sending out bills to all the different payers. That part is just very simple. There's just one bill that goes out to one payer, and that creates opportunities for more folks to work on quality assurance and expanding some of the outreach services and other things that have, in my view, more value.
right. And that was you know, those billing departments, and it was one of those things I've talked about with people where, you know, these billing departments, they have, you know, they always say it's going to be hard to make sure that doctors get paid. But the reality is that, you know, there are usually different stacks of bills sitting at these people's desks, or different queues that they're in. And, you know, the higher queues are always the private insurance queues, because they know it's going to be a fight. But the Medicare, the Medicaid queues are always smaller, and they're always the first ones to get paid. So the reality is, it's much easier to get money out of the government than it is to get money out of the private insurance, who's only looking to save money on their end. And I think that's an important thing. If we don't have to deal with that, then their whole day isn't built into being on the phone with the insurance company and trying to explain in a very kind of telephone type of way, where they don't really, they don't know the person that has that bill, and they're trying to explain why they need this service. That now they can get, the doctor can just get paid, rather than having to fight half the day, and then also the doctor's business has to fight. They have the manpower instead of helping patients. They're spending them manpower talking to insurance companies, which is crazy to me. You look at some of these back offices and these doctors' offices, and they look like they just don't want to be there, and it's understandably. You see what they're dealing with. They just look like that they're about to get into a fight with somebody, and they are the insurance company.
And what about us?
Yeah.
No one is looking at the cost to us of fighting with our insurance companies when a claim has been denied, or when we get a surprise bill, the hours you spend, and you may or may not get that properly adjudicated. It's a huge cost to us of the time that we spend in these fights, and so that would all just go away.
For sure. So real quick, I did want to say, if anybody's in the chat and wants to post a question, go for it. We will be answering questions at the end of all of this. And so I wanted to move on to one other thing. We have a couple other things, but this particular issue, because I have encountered it. I have a couple of friends who are police officers in the city. I have interviewed, obviously, with unions for their endorsement. That's kind of what you do when you're a candidate. And one of the things that always gets brought up to me is what happens to us, referring to the union. What happens to the benefits that we have fought for, that we have sacrificed for over the years? What happens to those benefits? And my answer has been that I would put a provision in that says you can keep your health insurance for as long as your contract is for. And that when that contract's up, you get to transition to the New York Health Act. And you don't have to fight about your health insurance anymore. And I've gotten some fairly serious pushback about this particular issue, is that we have fought for this. Why don't we get to keep this? And I have attempted to, like I said, you now get to fight for higher wages, for higher worker protections, better worker protections. How can you better help me understand how to get through to the unions that this is a good thing for them?
Yeah, I follow this pretty closely too, on the national level, and I think the unions are fairly split. There are some unions that are very much in favor of universal health coverage, single payer, and I think I'm thinking of the teachers union, nurses unions. I think most recently the flight attendants unions come out very strongly that if we took healthcare off the bargaining table, we could focus on other things like higher wages and other things that we care about. So that we've had to sacrifice too many other things to protect our health coverage. And then we hear on the other side, just what you're saying, we hear other unions say, no, actually, we've sacrificed a lot over the years, and we're not going to get that back, all the lower wages that we've accepted, and we now have gotten something that we're happy with. Why would we walk away from it? So I think it's just split like just the electorate. Different people have different views on how to get to good coverage. But what I would say is that even union members that have good coverage today, there are no guarantees. And, I'm just thinking, what if you want to retire early? Or what if the industry goes bankrupt? And I'm thinking about the 1990s, the airline industry. My father's a retired pilot, and he retired at 60 because that was the FAA regulation. And then US Airways went bankrupt, and he didn't have coverage anymore, and was a man at age 60 without health coverage 5 years before Medicare. So just like any of us, we don't know what the future holds. And so I think as an individual, the New York Health Act offers you this security that is independent of your individual circumstances. And I think there are certainly transitional provisions that could be negotiated as the one that you're suggesting that could make that more palatable in the short term. But over the long term, I think everybody benefits from not having to bargain away other conditions of their employment to get health coverage.
And the other thing I've tried to express too is that if everybody could be in a union, they would be. The reality is that not all unions are exclusive, but a lot of unions are very difficult to get into. And that kind of creates a problem where I think if everybody was in a union, they might not be dealing with this issue, that everybody would more than likely have this great insurance or have this great healthcare because they have people fighting for them. But there are millions of Americans, millions of New Yorkers who don't have people fighting for them to make sure that they have this health insurance. And that's why I feel so strongly about it, is we need to fight for the people that don't have it, and for the people that do have it that could potentially lose it like that. We're seeing across the country, and this was one of the topics we were going to cover too, is that if your insurance is determined by your employment, then what happens when you're not employed anymore? You get stuck on these expenses.
We're seeing that today.
Yeah. I mean, that's why I'm hoping that maybe the one one and only good thing that comes out of this is that people see how fragile our economy is, and if you're basing your health insurance strictly on your job, that you might be in trouble when this is all done. We're gonna have a rough economic recovery from this, and there are gonna be a lot of people without health insurance, and there's gonna be a lot of people on these expensive COVID plans. And I'll be honest with you, I mean, if I were to get laid off and I got stuck on a COVID, I wouldn't know how to pay for it. I mean, that would eat up most of my unemployment.
There's thousands of dollars a month. I looked into Cobra once when I was transitioning between jobs, and it was prohibitive. I didn't look at it for more than 3 seconds. It was not possible. I think, what you mentioned there, Will, is very important, is, you want coverage for everyone. Who's going to fight for the people who don't? If this covers everyone, if everyone in the state of New York is under this plan, we are all fighting for this. We as an entire population are holding our government accountable, pressuring them, pressuring our elected officials to keep it working well, to make it good, to make it responsive to us. That pressure is way more powerful than the pressure that we have against our private insurers, which is almost zero.
Right.
And so we have actually some power at the table if we're doing this through a transparent process that is accountable to voters, not private insurers who are only accountable to their shareholders.
Right, and yeah, I mean, every in this recovery here, it's going to be hard on everyone, and I think you're going to start to see premiums be raised because they have to cover their costs to their shareholders. They have dividend payments that they're going to have to make, and they're going to, you're going to start to see, I think, a ripple effect that hasn't hit yet. We'll see what happens at the end of this year.
Well, right now the private insurers are doing very well. They're making huge profits because they're not paying for other services that aren't being delivered. They're making huge profits right now.
Right, but they're going to cry at the end of this year. They're going to
cry at the end, and then they're going to raise their premium. They've already signaled that they're
Right.
going to have to raise their premiums next year. So we're just paying from every direction, and they never absorb. They can pass off all of their costs onto us.
Right, exactly, and I think a lot of us are bracing for that, and the hope, I think, would be that we can get this passed, and it will be a thing of the past, and hopefully this helps us also transition to Medicare for all someday. That that's one of the things I hope the New York Health Act can do, is show the rest of the country that this is possible, that this is something we can achieve, so that when we are talking about Medicare for all again, it seems possible. I definitely think, and somebody brought it up, that we unfortunately have had universal health care stigmatized by the Republican Party as being communist or socialist. This idea that we don't, I don't believe, personally, I don't believe capitalism belongs in healthcare. I don't think it works. I think, and we talked about this previously, but I believe one of the most important facets of capitalism is choice. And if you go buy a car, you get to choose what car you're buying. You get to choose where you're buying your car. You get to choose when you're buying your car. When it comes to your healthcare, you don't get to choose any of these things. You don't get to choose when you're going to get cancer. You don't get to choose where in life you're going to get cancer. Or do you have health insurance? Do you not have health insurance? You don't get a choice of where to get your cancer treatment with a lot of health insurance companies. They say you're going here, and the next thing you know, you're looking to be Walter White, right? Because you got no other way to pay for these things. It's crazy to me that that this has gotten so stigmatized with socialism as being such a bad thing when it comes to healthcare. It's like capitalism does not work in the healthcare system. It just doesn't.
Well, there are plenty of places in our economy to make a profit. Making profit off of people being sick doesn't seem like it should be one of them. And we see how that plays out in our system. But I want to hit on a couple of points that you made here. One is about choice. This is a famous talking point of the private insurance industry, that if we give up our private insurance, we're giving up choice. And that is so misleading, because what kind of choice matters to us? It matters to us our choice of doctor. It matters to us, can we choose the hospital that's closest and most convenient to us? Can I choose to stay at a job or leave a job? Can I choose to get married when I want to get married? Or do these choices depend on my health insurance coverage? And so that is just such a misleading argument, that we have so much more choice when the coverage is paid for. It's one plan, it's comprehensive, and the bills are paid for in advance. You are covered regardless of your life circumstances, and all the doctors and hospitals are in the same plan. So you can choose much more freely than we can now. And that's one of the ways that the private insurers are making a lot of their profit, is squeezing our choice. But they managed to flip that talking point on its head. The other one is this idea of socialized medicine. It just kind of makes me laugh. It's, so what does socialism mean? It means that the government is owning the means of production. So that we're not talking about the government owning hospitals and doctors, although we do have important public hospital systems in our country. Nothing would change in terms of the ownership of our hospitals and doctors. They would stay the way they are. And what would just change is who's paying the bill. And there shouldn't be profit in just paying the bill. There's no added value that those private insurers make, and they make huge profits for just simply collecting the money and paying the bills. And so that's where we would definitely take away profit. And I think in the process, take a serious look at the profits on the provider side too, where they are excessive.
Yeah, no, definitely. I mean, you look around and, and I don't want to, when we say the provider side, I don't want to demonize, doctors and nurses,
No, not
especially
at all.
nurses, they go to school and they make, by the end, they make some possibly really good money, but in the end, they have extremely high costs to get to where they are. Doctors, and nurses both end up having to take out an absolute fortune in student loans, and in most cases. And so I don't want to make it seem like we dislike them. We obviously love them, and we would love to make sure that they get paid quicker.
Exactly. And I want to be this is a very important point, that we want our doctors and our community hospitals and all of the providers who we depend on to thrive. This system has to be set up so that they thrive.
Right.
And the financing has to go, and it has to be fair, and it has to be adequate. And so no one wants it to be any other way. That is really, and all of the elected officials that I've spoken to in New York believe the same thing. And there's no way this could work otherwise.
Right.
But there's a darker side to our health provider side that is becoming clearer. The private equity firms buying up some of the, these practices, and these, kind of corporate conglomerate, they're behind the scenes, and we're seeing many, many rural hospital closures, not because they aren't needed, but because someone has bought them up and spit them out. And that is something that we could address, and we could look at that very seriously if we had more purchasing power on the financing side.
Yeah, on Long Island, I mean, you don't have to say any other name other than Northwell Health. They are, a huge conglomerate that owns a ton of hospitals. They just recently, I think, bought Mather or combined forces with Mather over here, and they have hospitals now in the Hamptons. And it's crazy. And when you get large conglomerates like that, it becomes a monopoly. And then now when we're fighting for the New York Health Act, we're fighting with them, because these are huge entities that have more money than we would even know what to do with. And they, and unfortunately in our politics, money talks. And
some of them behave well, and some of them don't behave well.
Right.
And if you had this purchasing power, negotiating power, then there would be a little bit more accountability.
Yeah, definitely. I mean, and obviously, when you look at who's against the New York Health Act, I'm sure you can trace it right back to who makes the donations. I mean, that's the reality. There's no logical reason to fight against these things. It benefits the people, and that's who we as politicians, or aspiring politicians, are supposed to be working for, are the people, not the corporations. And it's one of the unfortunate sides of Citizens United that decision did to our politics, has just flooded money and lobbyists into our politics. And it's one of the things I vowed is that, one, I take no corporate money. I take no corporate PAC money. I have no intention of it. And I have no intention of switching that up when I win the election, because in the end, if I win, it won't be because I had corporate PAC help. It's because I had grassroots help from everybody watching this and everybody who's donated to my campaign. And I would stick to that. I'll be honest with you. It's like, I know I'm going to be fighting, against a huge, conglomerate when I get there for this particular issue, and probably every issue that I'm for. And freedom of life choices, and we kind of touched on it before, was another issue we wanted to talk about, because, a lot of people are going to deal with this, but it's not just when you get laid off, but a lot of people are tied to their employment because of their health insurance. And I've looked at other jobs throughout the years, and the big question mark is always, well, what's the health insurance like?
Yes.
You don't really get to know. You might get told what it is, what the deductibles are, what the options are, but until you're dealing with health insurance on a regular basis, you know, you don't really know the ins and outs of that plan. Like you really can do all the reading you can, but you're not going to know until you get your first bill or your first major issue that, oh my God, I might have screwed myself here, you know, leaving the other job because now, you know, I'm paying out the nose for this service. So one of the things that I look at and go, you know, you have people out there that have pre-existing conditions, that have kids with pre-existing conditions. You have kids that have like cerebral palsy and muscular dystrophy and things like that, that parents are afraid to leave jobs that they absolutely hate because their concern is that they're going to leave that job and now their kid or their loved one is not going to have the coverage they have before. Yeah. And that's one of the reasons why I'm fighting for the New York Health Act too, because, you know, we should all be able to love the lives that we get to live, and being strapped to a job that you absolutely hate is not something that I think anybody intended when they created our government. Like, it's the pursuit of happiness, right? If you can't, you know, you spend most of your life at a job that you hate just because of the health insurance, that's crazy to me.
Yeah, and I mean, again, that goes back to choice. What
right.
choices matter to us, and what is really, you know, freedom of choice. I think that is really very confusing to a lot of my friends and colleagues in other countries, that we have to make major life choices based on our health coverage. And that is something that when you have just a universal system that is independent of your life circumstances just doesn't happen. And I think that you know, it's not even just choices. I have, you know, several friends who were in situations where their coverage was through their employed spouse, and their spouse died and so was no longer employed. They lost their spouse and their insurance coverage in the same month. So yeah, it's just, these are just heartbreaking consequences of our system that doesn't make any sense.
And there's also the possibility the spouse gets hurt, you know, and can't work. And then even if you're out of work for a certain amount of time, you know, you're going to get off that health insurance. You know, they're not going to keep paying for you forever. You know, and going back to unions, you know, unions, and, you know, on Long Island, it's happened, you know, they become insolvent and suddenly they're not paying for your health insurance anymore. Yep. So do you want, you know, guess what you fought for? And there's the retroactive anger, right? It's like, I sacrificed 25 years to get the benefits that I have. But, you know, it's the same retroactive anger we feel when it comes to, when we talk about health, college, you know, and we talk about, you know, student debt forgiveness. People get frustrated when you bring those things up because it's like, well, I paid off college already. And it's like, that's cool. But other people, you know, do you want the future to have to deal with the same problems you did, or do you want a better future? And that's how I try to frame things. And yeah, it's sometimes talking to a brick wall. And I'm sure you talk to brick walls, I'm sure, on a daily basis about this issue. And I really enjoyed this conversation. And anything else you'd like to bring up?
I would just, one last thing, that I think that, you know, for me, when we look at our health system and we hear stories every single day, I'm sure you do every day, of people who have a heartbreaking healthcare story or a frustrating healthcare story. Anytime you have to interact with our health system, something is going to be difficult. And we have this solution, and I can say from my professional perspective, the New York Health Act is a very well-written bill. It would make our health system better. And what holds us back? And I think what holds us back in a lot of ways is fear. People are afraid of the unknown and afraid that we could actually jump off into something that's even worse. And that's where I'd like to, I think, focus my energy, because it is really, I think, first of all, impossible to make our system worse, although the COVID-19 pandemic is showing that it is going to get worse. But the structural system itself is just really so badly designed that the New York Health Act would just unequivocally make things better immediately for almost everyone in our state. And so to let go of that fear and to not be really persuaded by the talking points of the private insurance industry, who do not have our best interest at heart.
No, they don't. I always, when I think of the private health insurance, one of my favorite movies was The Rainmaker with Matt Damon. I believe that was one of his first movies. You know, this was back in the 90s, I think. And, you know, he was a young lawyer fighting the health insurance company. Like I said, it was one of my favorite movies, but it's a real, this is what happens. You know, the people have to, you know, they deny. They deny coverage first, and then we'll accept it a second time. It happens all the time. If you appeal, you'll probably get approved, right? Why? Either approve. What is different about the appeal? And yeah, I think people, you know, we have people in Congress and people in the Assembly and state Senate and federal Senate that fight for the insurance companies and not the people. And it's baffling to me that, I'll be honest, our messaging as Democrats is so bad when it comes to this that we need to get better at it. They are able to come at us with such baby-like talking points, and we feed into it, and we don't know how to combat it. And it's happened all across this, and that's what I hope to bring to the assembly, is the ability to message, because I think we missed that in New York. We saw it with other issues this year where we did not message at all and we got killed. And this is the same thing. And if we don't message this, if we pass this and don't message properly going into the passage of the New York Health Act, people like Anthony Palumbo, who's now running for Senate, and John Flanagan will be out there on their pulpit, just like they were for bail reform, and just destroying us on it for the first bad story they get about the And I think it's important that we have people, hopefully like myself, that can go out there and fight for the things that we pass, and not have so many politicians in our government that don't get out there and do these things, that do the work after passing the law. Passing the law is half of the equation, I think. You get it passed, and then it's implementing it and messaging and making sure people understand the law. And that's something we miss in our government. And I'm thankful for people like you who get out there and are willing to, spend your free time talking to us about these issues. And, I know you're passionate about this, and I know that you work with other organizations like Long Island Activists, who I was endorsed by, and NIPAN, who I was also endorsed by. And I really appreciate the time. If anybody has questions, this is your last chance to throw them out there. Nobody chatted it up except for the communist line there. If there's anything you'd like to add before we wait for one more question, feel free. Otherwise, I think we can wrap this up.
No, just thank you. Well, thank you for the opportunity to have this conversation. I hope we can have more like this. I think the more people understand that it sounds too good to be true, it is that good, that we all deserve this. We deserve this kind of a health system in our state and hopefully in our country. And thank you for the work you're doing to get the word out.
No, thank you.
And best of luck to you.
Yes, I appreciate that. Thank you. And so for people who just chimed in and want to know more about myself, you can go to willschleisner.com, SCHLEISNER. Not the best last name for a campaign, for sure. Cheryl, do you have anything you want to plug? Any websites that you have that you'd like to plug and people get more information about?
I think, the Campaign for New York Health is a great website to get all the information about the New York Health Act in very easy to understand terms, and with really important stories and how this bill could make all of our lives better. So it's the Campaign for New York Health.
All right, excellent. I really appreciate you joining me, and I look forward to talking to you again. And like I said, we will definitely do this again as we get closer to election time. And I think this is key for messaging for candidates and for people that just want the New York Health Act passed. And I'll be fighting for this, win or lose, for sure.
Thank you for that.
Thank you for joining me.
All right, take care, Will.
Bye.
Bye-bye.
Okay, I stopped the live stream.
Okay, great.
All right, and I stopped the recording. Oh, that's my video. No, I didn't.